Post-acute rehabilitation is the step that people take after a hospital stay. If they're recovering from a surgery, an illness, an injury, a lot of times a hip or knee replacement surgery, stroke recovery, something like that where they're not quite ready to go home and they need that bridge in between the hospital and going home. When our clinical transition liaison, who's working in the hospital, meets with a family or a patient who needs post-acute care, they will talk to them about Hillcrest services and offer them the option to go to either our Bellevue location or our Papillion location. And a lot of times it's based on where they live or where their family lives. If the family's coming to visit often, we find that people from Bellevue, Papillion, South Omaha, or even in the city will come to the Bellevue location. Although we've come from Iowa and Council Bluffs, and we've had folks as far away as Lincoln come to the Bellevue location. That's our largest facility. And then the Papillion location is a rehab cottage. It's a brand new 22 accommodation cottage for folks. And we're finding that people from Westo and Gretna and Papillion and La Vista and Ralston are finding that that's the more ideal location for them, especially when they have an older spouse who's coming to visit them and they don't want to drive so far. Well, one of the best parts about post-acute rehab is because it's a medical service. If you have Medicare or other qualifying insurance, typically the first 20 days of a rehab stay are completely paid for at 100%. The way Medicare works, if you have a 3-night qualifying stay in the hospital and then come to post-acute rehab, Medicare is going to pay that first 20 days completely, and then from days 21 through 100, they're going to pay about 80% of the bill. So you'd have a copay, but most of our folks are able to complete the rehab within the first 20 days. It's interesting, a lot of aging adults get really nervous about the idea of post-acute rehab because they think, oh, it's offered in a nursing home or a nursing facility. And the way Hillcrest has provided post-acute care is that we offer completely dedicated facilities for post-acute rehab. So they're not mixed with a nursing home population. It really is people who are there to recover, and everyone is looking to get back home. A day in a life in rehab is a lot of therapy. It's focused on recovery. You're working with your physical, occupational, and speech therapist if needed, a couple hours a day, learning to maybe walk again or learning to do things when you return back home. They work with you on the activities of daily living. So you learn how to cook or do the dishes or put things away in the cabinet or take a bath when you have a new knee or a new hip, or you're trying to recover from something that you had to deal with. For post-acute rehab, we find that people come to us for two different reasons. One, they pre-plan. They know they have an upcoming surgery, a hip replacement or a knee replacement, or some other joint replacement surgery. They actually contact us, take a tour of our locations, and determine where they want to go, and we pretty much reserve a room for them and work with their physician to let them know that they will be coming to us. The other way is when it's unanticipated, when somebody ends up in the hospital and they're recovering from an illness or an injury, and the discharge planner in the hospital will coordinate with our team to get them over to our facility. And so in that case, we have a transition liaison who works in the hospital. It's our team member, but they'll coordinate with the family and they'll talk to them about the admission process and coordinate the entire move to get them into post-acute rehab. So when someone's in the hospital and wants to inquire about admission to Hillcrest Health and Rehab or Hillcrest Country Estates in Papillion, they can call our number at 402-682-6588, and they can speak to a clinical transition liaison who can coordinate that admission and let them know everything that they need to know about coming to our facilities.